CareFlight started in 1986 with just a single helicopter operating here in Western Sydney, but CareFlight's now Australia-wide, utilising 11 aircraft including helicopters, fixed-wing turboprops and small jet aircraft.
I now, even though you've been going for 54 days, I now officially declare CareFlight launched.
In our first year of operations in 1986, we treated 200 patients, but by the end of our 25th year of operations, we will have treated 25,000 patients. And we're now so busy that it will take us only another 4 years to have treated 50,000 patients.
There were a lot of people who said it couldn't be done, but in those days it was quite, it was very new. There was nobody else doing critical care retrieval at the same level. It meant that although a lot of people could opine on what they thought was going to happen, as nobody knew it was going to happen, and in fact least of all us. It really was cutting edge stuff then. So, driving that through against bureaucracies and people who just didn't believe it could happen or should happen or would happen was quite difficult.
A request came in from Westmead Hospital because in those days the hospitals were able to call us direct. There was no structure in the ambulance service as it exists now to coordinate that. The hospital contacted us and the helicopter flew up to Lithgow on consecutive runs to bring back 2 kiddies who'd been hurt in a car crash, brought them back to hospitals in Sydney. And that was the start. It was the start in many ways. It was the start of inter-hospital retrieval work. More importantly, it was the start of looking after kiddies. And even more important than that, it was actually motor vehicle related crashes. In the retrieval environment, whether it's at a cliff, at the base of a cliff with an injured patient, whether it's in an upturned motor vehicle or it's in a small hospital, it's them working with the team that's with them, with their equipment, that's going to make the difference.
It is about saving lives, but it's also about decreasing people's disability after an injury or illness, so they return to work and return to their family faster. And getting to people faster, instituting treatment faster and transporting them back to the care that they need means that they will return to their family and back to work more quickly than they would otherwise.
I thought it was a news helicopter when I saw it. I heard it. It's going to cost me a pretty penny, isn't it?
It's going to cost you nothing. In New South Wales, we fetch the patient, we worry about the dollars and cents later on, okay? And it's the mums and dads' dollars and cents that makes that keep happening.
Nobody appreciates the value of what they do when they make a donation more than the people who are actually out there doing the missions, because without their donations and their support, we can't do it.
It's the mums and dads, that have put in their 10s, 20s, 50s, 100s, 200s, etc. They're the people who are the lifeline for CareFlight.
I think it's a vitally important service to have. I think that we can deliver a very rapid response in a very timely fashion at a more than teaching hospital standard.
It's not my helicopter, it's not the pilot's helicopter, it's not the doctor's or the nurse or the paramedic's helicopter. The helicopter belongs to the lady who makes jam, donates it to us so we can sell it. It's the person who buys a bear. It's somebody whose son or daughter was flown to hospital. It's their helicopter. We don't own it, they own it, they make it financially possible. It's there to serve them, and we want that helicopter, that medical team, to be theirs. And the more education, the more understanding people have about what we do and why we do it, the more they'll support us.
I think we've got a critical mass now such that it would take a hell of a lot of fire retardant to stop CareFlight now. You'd have to starve it of oxygen, put a lot of foam on it and bury it under 1 million tonnes of earth to stop it. I think CareFlight will get bigger and better. It appears to remain focused as a patient-orientated organisation. It's breaching out into areas of education, into country and regional areas. So when we're not there or while they're waiting for us to get there, those people know what to do. And I think that's a very exciting position for us.
We should all be thankful that these dedicated aerial resources are available for rescue and medical support at a fraction of the cost to taxpayers than otherwise would be the case.
25 years ago, I couldn't have hoped to dream that we would have achieved what we had. I can't dream where we'll go, but I do know that if we bring the community with us, if we motivate others to serve with us, and with a bit of luck, and with some political support and some business support, we can get there.